Yes,
Hey, how are you?
I'm fine. How you doing?
I'm good. I'm Nurse Robinson. I'm going to be your nurse today. Do you mind if I close this door to give you a little privacy?
Yeah, that's fine.
All right. So I'm going to go ahead. I'm going to start off by cleaning my hands before we begin. May I have your name and your date of birth, please, while I check your armband?
Anthony Robinson, 11283.
Okay. And Mr. Robinson, do you know your reason for your visit today?
Yes, I'm getting a checkup.
Okay. And do you know what today's day is?
Today's Saturday,
And the year?
2020.
Okay. First thing I want to begin is with doing the Fallon's test. If you would please go ahead and place your hands like this for me. A little lower down.
Okay.
Okay. I'm just going to ask you a few more questions, okay?
All right.
All right. Are you in any pain?
No.
Do you have a cough?
No.
Do you have any history of TB?
No.
What about respiratory infections?
No.
Do you have a history of pneumonia?
No.
Okay. And have you had the flu vaccine this year?
No.
Have you had the pneumonia vaccine this year?
No.
Okay. And do you feel any numbness or tingling in your wrist?
No.
Okay, go ahead and put your hands out like this for me. I'm going to go ahead, I'm going to do the Tenille test. I'm just going to tap here on your wrist. And tell me if you feel any numbness or tingling
No.
in either wrist.
No.
Okay, so you're negative for both the Fallon and the Tenille test. The next thing I'm going to do, I'm going to document it in the charts that you are alert and oriented ×4. I do not see any respiratory distress or any retraction of your chest. If you can go ahead and hold your hands back out again for me, I'm going to check your hands, turn them over, and I'm going to check for any nodules or any crepitus in both of your hands. Do you feel any pain or tenderness when I do this?
No.
No pain or tenderness in either one of your hands? Okay, and I'm going to check your capillary refill. I see your capillary refill is brisk, less than 2 seconds. All right, and I'm going to go ahead and I'm going to report some vital signs that we previously took. Your blood pressure was 120/80, so that's good. Your pulse was at a 60. Your temperature was 97.4, and your respiration was at a 15. So everything there is good. So the next thing that I want to do is I'm going to go ahead and I'm going to inspect your face, your head, and your ears. Okay. I don't see any lesions or bruising or any discoloration. I don't note any cyanosis of your lips. There's no blowing of your lips. I don't see any signs of any infection or infestation. Your beard and your mustache are nicely groomed.
One second. Oh, I'm sorry. It's my mom. Hold on.
Okay. All right. So the next thing I'm going to do is I'm going to check the temperature on your face. And I note that the temperature on your face is appropriate. I'm going to also check for skin turgor. I'm just going to pinch your skin right here. And I do not note any tinting. So that's good. And then I'm going to palpate your scalp. What we're feeling for is any swelling or any edema, which I do not feel. So that is good. I'm also going to check your pulse. I'm going to check your temporal pulse as well as your sinuses. So let me know if you feel any pressure. This is where your maxillary sinus is. Any pressure there?
No.
And your frontal sinus. Any pressure there?
No.
Okay. So now I'm going to go on and I'm going to check your lymph nodes. And we're going to do one side at a time. So we're going to do your preauricular, then your postauricular. This is your occipital, your submantle, and then your submandibular. And turn your head slightly for me. I'm going to do your jugular digastric, anterior cervical, your posterior cervical, and then your deep cervical chain. Okay, I'm going to do the same thing on this side. We're going to do preauricular, postauricular. I'm going to do your occipital again. We already did your submental, submandibular, so I'm going to do your jugular digastric, your anterior cervical, your posterior cervical, and your deep cervical chain. Okay, and then go ahead and shrug your shoulders for me, keep them shrugged. And I'm going to check here for your supraclavicular. Okay, all right, good job. I don't see any deformities or anything with your lymph nodes. So we're gonna go on to your cranial nerves. So the first thing we're gonna do is start with cranial nerve number 1. It's gonna deal with your sense of smell and your nostrils. So I don't see any deformities or any discoloration on your nose. I don't see any signs of bruising or anything. I'm gonna use my pen light and I'm gonna check in your nose. If you'll tilt your head for me. Okay, I don't see any lesions or any blockage. Your septum does not appear to be deviated. So everything there looks well. If you don't mind, I'm gonna have you place one hand over your nostrils and breathe in for me and breathe out. Do the same thing on the other side. Okay, now I want you to cover one of your ears and keep your eyes closed. I'm gonna have you smell something and you're gonna do it on both sides and you just tell me what you smell. Go ahead and close your eyes. Tell me what you smell.
Alcohol.
Okay, go ahead, cover the other side. Keep your eyes closed. Tell me what you smell.
Alcohol.
Okay, good job. All right, so the next thing we're going to do is move on to cranial nerve number 2. We already did your Snellen chart for your vision, which was at a 20/20. So I'm going to have you look at this Geiger card. And I just want you to hold this out about right here. And I want you to read to me the first sentence.
A retired search is not prepared for a stray puppy to come into his life.
Okay, good job. All right, so now we're going to move on to cranial nerve 3, 4, and 6, and we're going to check your pupils. So I'm going to use my pen light once again. If you go ahead, tilt your head back just a little bit for me. I'm going to check your conjunctiva, which I see is nice and pink. Your sclera is nice and white with minimal veining, which is normal. Go ahead and look down for me. Same thing, I note your conjunctiva is nice and pink and your sclera is white. And note the same thing bilaterally on both eyes. So I don't see any signs of any infection or any severe redness of your eyes. I note your pupil gauge is about a 4. So what we're going to do is we're going to be checking for your resting pupil size, which is a 4, and your constriction. We're going to do that on both sides. Just shine this light into your eye. Okay, and do the other side. Okay, I note that your constriction goes down to a 3 bilaterally, which is good. The next thing I am going to do is I am going to do a vision check. I want you to focus on my nose and just follow my finger in every direction that it goes in. Sit back a little bit. Okay. All right, just follow my finger. Okay, good job. I want you to keep focusing on my nose, and I'm going to have my finger that's going to come in towards your face and back out, and I just want you to follow my finger with your eyes. Okay, good job. So everything there looks good. I don't note any deformities or anything. I note that your eyes are equal, round, and they are reactive to light, and they both accommodate. So what we're going to do next is go on to cranial nerve number 5, and we're going to be checking the sensation on your face. So if you would please go ahead and close your eyes again for me. And I just want you to tell me when you feel the sensation on your face.
Mm-hmm. Yes. Yes.
Okay, Good job. All right, so we're also going to check for TMJ. Place my fingers here, and I want you to open and close your mouth. Go ahead and bite down. Okay, open your mouth, stick your tongue out side to side. Okay, good job. I don't know any crepitus there. Was there any pain or tenderness?
No.
Okay, and I didn't hear any popping sounds or anything. So the next thing we're going to do is move on to cranial nerve number 8, which is your ears. I don't see any discoloration or excess draining coming from your ears. I do see that you have piercings on both sides. So I'm going to now inspect them. I'm just going to pull your peanut up and back and look inside your ear. I'm going to take my otoscope and I'm going to turn it upside down. And I don't see any excess buildup of cerumen. I don't note any blockage. Same thing, I don't see any blockage or any excess buildup of cerumen. I do note that your tympanic membrane bilaterally is a nice pearly gray color. And on your left ear, your cone of light was at 7 o'clock, and on your right ear, your cone of light was at 5 o'clock. So the next thing we're going to do, Mr. Robinson, is we're going to move on to cranial nerves 9, 10, and 12. With this, I'm going to be expecting your mouth. As I noted in the beginning, I don't see any discoloration on your lips, no signs of cyanosis. If you wouldn't mind, could you please open your mouth for me? Okay. Hard palate and soft palate both appear to be intact. The submucosal membranes are nice and moist inside of your mouth. I do note that you have had some previous dental work. And if you stick your tongue out for me a little bit, I can see your tonsils are at a grade of about a 2. Your uvula is nice and midline. What I'm going to do now is the gag reflex. And okay. Go ahead and open your mouth for me. Okay, good job. All right, so everything there is intact. What we're going to do now is I'm going to move on to cranial nerve number 11, which is going to be dealing with checking your neck. And it's a little range of motion because it's going to be testing the strength in your shoulders as well. So if you wouldn't mind, try turning your head towards this way. Good job. Turning your head towards this way. Okay, and you shrug your shoulders for me. Okay, and I'm going to put my hands, and I want you to shrug your shoulders up against my hands. Okay, good job. All right, so cranial nerve number 7, we're going to be doing some facial movement. So if you wouldn't mind making a kissy face for me. Okay, and can you smile? Good job. And now I want you to blow air in both of your cheeks. Okay, and the air is released bilaterally equally on both sides. Now, if you wouldn't mind raising your eyebrows. Okay, good job. All right, so all 12 of your cranial nerves check out and everything there appears to be good. What I'm going to do now is I'm going to use the bell of my stethoscope and I'm going to be checking your carotid pulse. Checking for any brewing. What I want you to do is I want you to inhale and exhale and hold. Okay, so inhale.